healthcare providers is facing financial struggles. Northern Light Health officials say they need to make changes across the state to continue operations at their full potential. CBS 13's Allison LaPierre tells us the reasoning behind all of this.
Northern Light Health officials say last year alone, their company lost over $150 million due to increased costs, combined with reduced post-COVID volumes and more. Officials say they hope changes within the company can help achieve financial sustainability.
We're committed to being here for generations to come, and we need to make sure that our business model changes so that we can ensure that future.
Paul Bolin, Northern Light Health's executive vice president, says the hospital's healthcare system is struggling financially. As a result, he says Northern Light Health will look at cutting programs and potential layoffs.
The intention, of course, long-term is to have revenue exceed expenses so that we can reinvest in additional equipment, additional services, staff, and other planning that would be needed.
Bolin says they need to make changes to their operational model, like evaluating which positions are necessary.
If there's a greater need for obstetrics, women's health, pediatrics in one part of the state versus geriatric care and other primary care or chronic health management that might be increasing at a different pace than others, we need to make sure that we're offering services where they're needed in a way that's sustainable.
This decision comes weeks after a letter was sent to President Trump by a group of U.S. senators. It lists more than 300 rural hospitals they say are at risk of possible closure because of potential Medicaid cuts. That list includes 2 Maine Northern Light hospitals. But officials for Northern Light Health say they don't anticipate any hospital closures.
Our focus really is to make sure that we have the right structure to support what the community needs for care.
Bolin says there's a possibility that some of the 10,000 employees at Northern Light Health could be laid off, but says they are looking at other options.
When a position becomes open, do we need to fill it? Can we do the work in a different way?
Northern Light Health officials say they will continue to work with physicians, nurses, and staff to find the best path forward. In Portland, Allison LaPierre, CBS 13 News.